Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. I don't know what you're seeing, but on my computer, my head looked very big. In any case, thank you all for listening, and please, if you find value in our shows, subscribe and tell your friends about it. It's free, and you may not need all the different shows that we've done right now, but over time, you or one of your friends and loved ones, family, may find one of the shows that we've done have been life-saving, let alone just simply beneficial. I want Biome at doctorsbiome.com, doctorbiome.com. Special probiotic beverage. Everybody should be taking it once every day. Delicious. It comes in these 2-ounce shots. I think I have it right now that you can see. It comes in, it's delicious because all the probiotic strains are living in a 100% organic vegetable fruit juice. Um, Revived stomach acids are destroyed, virtually speaking, in the stomach from the acids if they come out of suspended animation in the capsule powder tablet form they came in. Um, if they survive that, which is not survive stomach acids and bile salts, which is unlikely, these are created because they're living in that 100% organic, delicious juice. They're all ready to go. And they survive the stomach because they're next generation bacteria created to do that. And then they stick to the wall of the gut because they're called smart probiotics. They didn't go to Harvard or Yale to get a degree. They actually are created to change their genetic expression and become a healthy part of you in your gut wall, which is why they work in controlling so many different. Um, so, as you're going to learn, even why they're important. So, show is dedicated to edema. And by those, the coupon code Howard35, you'll get 10% off the retail price, which is not inexpensive, but worth every penny. And it comes 100% money back guarantee. How can you lose? If it doesn't seem to make you feel better or help you, you'll get your money back. Call them up. Okay? Over 90% of the people that take it, because it just makes that kind of a difference, taking 1 2-ounce shot every day. Children and babies love it. Babies and children need it. It helps prevent the colds and all the other infections and things that they get. Um, uh, so they need probiotics just as well as don't give them as much. Um, you give them small amounts of that 2-ounce bottle in age. But let's get right into our show. Edema is basically swelling, and you can create excess fluid anywhere in the body's tissues. Um, Feet, ankles, legs, predominant your hands, but it can occur almost anywhere in your body where you might retain around your lungs. It's called congestive heart failure. It's a horrible situation. You have trouble breathing, and you can die from it. Um, so, what causes this edema? Infection and injury, obviously, are common causes of this. If you get an infection, that's one of the signs, swelling in the area, and that unfortunately works against you controlling the infection. Injuries, ankle sprains, falling down, hitting your knees, your elbow, shoulders. You can get swelling in any of the joints. Muscle injuries cause swelling in the muscles, and you'll get stiffness and soreness when you try to move them. Okay. Um, Venous insufficiency are commonly can cause in lower legs, a heaviness or aching in your legs. Um, the swellings generally worsen in the day. For those by themselves, you should probably and need to be wearing support stockings. Walking is good. Sitting with your feet and legs elevated, waist just slightly above. You never want to lift your legs way above your head to try to get the swelling down, because if your lymphatic system can deal with the drainage well, you're going to wind up causing congestive heart failure, and you may not have a problem. It's just inability to get rid of the excess swelling fast enough. Um, But wearing support stockings supports the vein. We've done, I believe we've done shows on. I certainly should do one, and I have to go look it up because while I've been doing podcasts for over, well, several decades on different cast channels. I've only been doing it here on YouTube for a couple of years. This is our second year, I think. So sometimes I haven't gotten to some of these podcasts that we've done in the past. One planned on water and other things as well coming up. So we're dealing with water here right now. So elevation of the legs, wearing of support stockings helps with the vein problems. Um, Helping with the blood flow when you're having is important. And we're going to get into some of the supplements and things you can take in a little bit. Heart problems can lead to this happening around your lungs, but in your abdomen, you get a big swollen belly called ascites. You can get it in your legs, basically because your heart isn't pumping well enough. So that's where you have heart disease, and you need to get help with that. Intravenous ozone has been proven beneficial in dealing with those issues um, as well. Kidney disease is of it. And that's where your kidneys may be inflamed or low-grade infection. A lot of people don't realize that's why the kidneys aren't working right. It's not just because you intake too much sodium, which people do. The average American needs only um, no more than 2 or 3,000 milligrams of sodium a day, and most people are taking in 10,000 plus milligrams of sodium a day. They're way overdoing it. Um, when you only need a couple of 1,000. Um, Liver disease, if you're in cirrhosis of hepatitis or problems of various types can cause it. Uh, Viruses like hepatitis B, A, B, and C, D, E, F, G. I think we've done shows. Hepatitis that can cause it. Various medications can cause you to steroids, um, blood pressure medications, NSAIDs. All the inflammatories can lead to. Um, some people get blockage in their lymph system. It could be caused by parasites. Many of these things are fixable ozone therapy. Um, Pregnancy is another whole separate because there's different types of edema that's caused during pregnancy. Here, I recommend only natural ways of treating it. Some supplements, reducing salt intake, um, uh, keeping your feet in stockings that go up your leg, not just your lower leg. If Generally, starting on the second pregnancy, these big issues. So, starting with the first, you should probably be wearing support stockings. Not many women do it for various reasons, but in the end, they'll wind up with ugly varicose veins and other issues where they just feel tired getting up and walking around. And that's very valuable, walking around, that is, if you are pregnant. Um, you can get edema in your eyes, um, swelling in your retina, and this is seeking medical attention. Um, if you fall and hit your head, you can get swelling in your brain, another life-taking situation here. So if you have a fall where you've hit your head, don't dawdle. Get over to an emergency room and let them check you to make sure you're okay before it's too late. Um, Anytime, or if it came back, I call it where no acute situation, haven't been acute, hasn't taken place. I call it Robin's 24-hour rule of medicine. If something goes away within 4 hours, don't worry about it unless it keeps coming back. Okay. And then the key is to go get it diagnosed. Now, if something happens during the day and you're getting swelling, you see it's worsening, get over to an urgent care center or to an ER right. Okay. Um, Anytime there's rapid, always go and get yourself checked out right away. Dawdling could be a life-threatening situation occurring. because blood clots and heart failure and can lead to these things happening. So, how do you treat all this if it's chronic? Okay, if it's chronic. Well, intravenous ozone therapy, I pointed out, particularly the direct IV method, not the blood methods of ozone, have been proven very effective in eliminating edema throughout the body. I mean, sometimes when you have congestive heart failure or disease from cancer and things, they just need to drain it. And it's done generally in a hospital, in an ER, or sometimes perhaps urgent care centers do it. Of course, they're staffed by ER doctors where they can do this safely and comfortably, and there's no reason to suffer. So when it builds up enough, they can take out sometimes a liter or more of liquid that doesn't belong there. Um, Another way to get rid of excess edema, stimulate your kidneys to work more. And the way to do that is by drinking more water. Okay, so the problem is you're retaining water, but by drinking more, your kidneys to eliminate the excess water better. I know it sounds counterintuitive, but it's exactly what can help and work. Of course, we spoke earlier, limiting your sodium intake, sodium salt, no more than 1,000 or 2 milligrams a day, maybe 3,000 is okay in some cases, particularly if you've been sweating a lot. Trace mineral, so sea salt is what I usually recommend to patients. And if you need to add extra salt to your diet, a teaspoon to a gallon of water. So, or a quarter of a teaspoon of wort, okay, is about the right concentrating all those wonderful trace minerals that you need from sea salt. Regular movement and exercise, just by moving around and using your muscles and pumping your heart better, of having the muscles contract, force blood up and lymph and water up and out of your body. Remember elevating your legs high or slightly higher with a little throw pillow, never way up. Otherwise, it can lead to more serious problems. If necessary, you wear compression stockings. Today, they make them custom made as well. You can get them in surgical supply stores, sometimes even in pharmacies. Um, you should listen to the shows that we've done on. There's ways to deal with stockings in an appropriate way. You never need to put them in the washing machine ever. You always turn them inside out, hand wash them in warm water just to get sweat and dead skin cells out, and hang them to dry. You should have a few pairs so you can alternate them each day. And every so many months buy new ones because they lose their elasticity and their compression. Um, you got in pharmaceuticals may even be necessary. Um, Diuretic medications can be helpful at times. Against this is functional medicine. I'm not against the use of Lasix and other pharmaceuticals if you can't, if you're in an acute situation or a subacute situation and you have to quickly get rid of excess water. Then the key is to diagnose the cause and then deal with the cause so that you don't need to be taking these supplements all the time. Professional advice. If there's a chronic situation, you should somebody who knows what they're doing and make a diagnosis. Don't just try to treat things all on your own. Um, Unless there's no choice because you live in the middle of USA or the world and there's no doctors that you can trust around. But always try to find out what the cause of problems are. Now, when you're dealing with leg and vein problems, you want to help in blood flow. Um, there's various vein supplements. We use one in Vessel Max. Vitamin C, very important to help in blood flow and vein repair. Horse chestnut um, can be very helpful. Uh, Ginkgo, uh, grapeseed extracts that can help when veins are the issue. Um, when dealing with these chronic swellings and whatnot. Um, and then there are a lot of natural diuretics. dandelion and parsley, ginger, juniper and hawthorn, and you can get all online or in almost any health food store. Start with low doses several times a day, 3 times a day, and then see if you need more. You can always increase the amount. Start with one at a time and see how it works. Dandelion, parsley, hawthorn, juniper, and ginger, I think are the I would recommend. Um, Along with the horse, 5 or 6 times a day. Listen to the show that we did it. Remember, it works for 2 hours and then it's gone. You need it in every healthy cell of your body. Um, so have more edema issues. So losing weight may make a big difference. And then, of course, when there's medical issues involved, you know, a medical ozone intravenous, the direct IV, been proven to be way, way, way effective. Well, if you have any more questions about this, you can email me at ozonedoctor@yahoo.com. That's DOCOZONE all spelled out at yahoo.com. Please remember to subscribe to the show. It's free and it helps us stay in business. Um, or call my office in Manhattan with me at 212 581 That's 212 581 Everybody, thank you very much. And it's a pleasure. And stay safe, stay healthy, and stay well, and tell your friends about the show. Bye now.